Alright, so today I'm going to be talking about an exercise plan for somebody for a female that was 45 years old and ended up getting in a motor vehicle accident. She has complaints of bilateral neck pain and headaches. She has limited cervical rotation bilaterally, decreased cervical extension due to pain for both of those, and deep neck flexor and extensor endurance is less than 5 seconds. So she has pain and a heavy head feeling. Her only relief is when she supports her head in her hands or puts on a cervical collar, forward head and rounded shoulders in her posture observation. And what she would like to get back to is Zumba and spin classes. So for her beginning exercises, I would have her start with snags. So the reason I would pick snags is because it's a passive mobility. It helps maintain connective tissue and the elasticity of the muscles. So I'm going to have her do a rotation from both sides. So you'd cross it and going over. This very well may be a relieving exercise. If it's not, it's still, like, as long as there's no pain, I would have her do both sides 10 to 15 times, 2 to 3 sets, and then honestly as often as she can throughout the week, but I would say 4 to 5 times a week. And then along with the rotational snags, I would have her do an extension, but more so for her headaches. So it doesn't necessarily need to be the full extension, but more of the traction. So getting it right up underneath her skull and then pulling it straight up. This exercise very well should be a relieving aspect, and if it's not, then she shouldn't do it at all. But that should help relieve her headaches from the accident, and she can do that as often as she wants. That one's not necessarily even an exercise, that's just a relieving technique. That's just good to put along with the snags, the rotational snags. Next, I would have her do what I call open books. So she's going to be side lying, and I gotta make sure I can see here. You can see me. So she's going to be side lying, and I very well know that she's not going to be able to get through the full range right away. She can have a pillow, but she's going to be starting here, and she's going to watch her hand as it goes up. Here, and you go all the way back. Keeping your hips level is important with this, because if you're not keeping your hips like perpendicular to the floor and you open that up too, you're not even really working on your neck rotation anymore. But the main focus for this exercise is for focusing on keeping it within a range of pain. So you don't want her to really get to pain with this. We just want to work active range of motion right away. It's just good to be working within active range right away. So she very well might even start with, not even getting quite to 45 degrees. Bilaterally, she might start here. But the purpose of this is, again, to work through active range. And then as she's doing the snags at this stage, she should be increasing her mobility and just trying to work the active range of motion right away, like as soon as she starts to be able to go through that range without any pain. So those two are really working together to try and push the other one through range without any pain. And then moving on into the intermediate stage, I would do cervical isos. And because we were focusing so much on range of motion to start, it's good to start strengthening those muscles, because otherwise if you're not strengthening within that, you could lose it, or it's just not going to be very functional if you only have range but no muscle to go along with it. So I'm just going to come to a wall here with the same towel that I used, and I'm going to have her do it in all the directions. So getting close, pushing through. With this, you want her to to be doing maximal contractions, you want her to be doing at least 60% of her like max. And of course, you don't want to be like pushing through pain, but because you're doing the decreased range of motion by doing the isometrics right at the wall without being already in a position of any like movement, like through any really range, you shouldn't really have as much pain due to the lever arms not being as long. Exercise would be done 10 times each direction, holding it for around 6 seconds. So this is going to be like focusing on the endurance as well as strength, like strengthening the muscles, and then doing this 3 times a week. For the open books, I would suggest doing that one more often. So I would do that one 10 to 15 times. She might start honestly lower than that because of pain and just overall lack of endurance. So it's fine if she starts lower, so like starting at like 6 to 8 bilaterally again, but trying to work up towards more endurance and being able to go through more and more range. So that would be, yeah, like I said, kind of anywhere from like 6 to 15, 3 sets, but 5 times a week. So you really want to just focus on getting the range back and then trying to get it without pain. So this next one is going to be a little bit modified for what you would ideally have, but if you had like a red dot pointer, it would be better, but also if you had the legitimate headband with the head with the red dot, because I'm going to be using just a tape measure and I'm going to be holding it on my head, which is not going to be as accurate of a representation of what's really going on. But this is going to be a deep neck flexor exercise. It's going to try and focus on mobility and stability, and kind of just working that neuromuscular control, the endurance. And I'm just going to have it here. Again, I'm going to kind of go into that deep neck flexor, so like double chin. And what I want to do is try and keep it as stable with my hand, because I don't want my hand to actually influence where it's going, but I want to slightly move my head up and down, and then getting back to neutral and going side to side, all in that like deep neck flex position, the chin tucked. And so I was doing up and down and then side to side. So just doing that to make kind of like a cross or a plus sign. So for this, I would have her probably do like 5 of those pluses, and then work up towards doing around 10 of them. Again, to start, it's going to be tough being in that neck flex position and working through a little bit of range. And it's just going to be a lot on the endurance, and the muscle strength just isn't going to be there to maintain that for a long time. And then I think she should do that 2 sets with a little bit of a break in between, and then doing that 4 times a week or so. Because we're mostly focusing on endurance and not strength, it doesn't necessarily need as much time to relax in between, but it's going to be important for her to be able to like get that endurance back, and it's still going to take some time in between to really see some growth in the amount of time that she can do it. And finally, reaching the ending stage here, we're going to try and get her back to doing what she likes to do. And a lot of what she likes to do is endurance based. And the first one I'm going to have her do is going to seem silly, especially with me doing it, but because she likes doing Zumba, I'm going to have her do a chin tuck, because that's probably going to be one of her most difficult positions to do, just endurance wise, and obviously because of the accident. So you're going to have her chin tucked, and you're going to have her raising her arms, and she's going to alternate with them. So chin tuck, she's going to be going like this, and as well as that, she's going to be moving forward and backward and side to side. So it's going to look like this. again, we're just trying to make it as difficult as she can while she's like in the clinic, and giving her these exercises so that while she's out doing these activities, she's not really finding difficulty in, like, because of her muscles, from the accident. Obviously, it very well may be difficult and exhausting, but you don't want her to be complaining that she can't do it just because of the accident and her neck. And then the final exercise, you're going to go down to the weight room. So, see you there. All right, so I'm in the gym now. I forgot to mention for the last exercise, for the overhead arm pumping, that's obviously more of an endurance aspect. Depending on how much she's doing Zumba is kind of how I would find out how many times a week she should be doing it. I would say to do it as many times as she's going to Zumba, as long as she's not actually going to Zumba yet. And time-wise, I would say starting lower, so doing 30 seconds, kind of working your way up towards a few minutes. During Zumba, you're not going to be doing that motion constantly for multiple minutes, but again, kind of trying to focus on doing that exercise to the point where as you're in Zumba, you're not realizing that, oh, my neck's starting to hurt from this repetitive movement. So again, kind of trying to get it up to a few minutes. Maybe, like, if you know you're doing that a lot in Zumba class, try and go a minute longer than you do in the class, and then doing 2 to 3 sets, just to, again, kind of just get that endurance up, work on that strength. And now for this last exercise, I'm on a yoga ball, and I'm going to be doing a deep neck flexed row. And this exercise is going to be for kind of trying to help her get back to cycling, but also kind of focusing on what might be difficult about cycling rather than just getting on a bicycle or a stationary cycle and just doing that motion. We're going to just try and focus on the muscles that could aggravate it while she's doing that. And again, I'm kind of thinking that the deep neck flexed and being on the ball helps mimic the movement that while you're cycling, you know, you're moving around a little bit like as you're pedaling, and keeping that deep neck flexed. You might feel it all the way down your back of your spine. And if you're having to stop in spin class because of that, this exercise, might not take as much time as sitting there on a bicycle for 20 minutes trying to get that recreation of the symptoms. So again, this exercise is trying to go to the root of the problem, trying to get that deep neck flex area to be really strong while on an unstable surface. So here, I have the rowing machine here. Probably best to use a cable in the deep neck flex position, and then bringing it back and letting it go. This one is definitely going to be focused on a lot more strength than the overhead movements. Like I said, that one's a lot more endurance based. This one's really going to be for strength. So doing this one 8 to 12 reps, 2 to 4 sets, around 3 times a week. Again, you can kind of vary this with how, like, if you do think it's effective, but this one's, because it's strength based, you're really probably going to want to give your rest days in between. So I'd say 3 times a week is going to be the best, like, optimal chance for growth in these muscles. And that's the whole exercise program from beginning, middle, and end. And at this point, she's hopefully able to do the things she enjoys and isn't groveling too much about the pain that's in her neck from her accident. Sadly, just being in the clinic as a PT tech, a lot of motor vehicle accidents do have a lot of pain, especially in their back and neck from those accidents, that it's just really hard to get away. So this exercise program may take quite a while. It just might not progress as fast as you want it to, but ultimately you're wanting to get to that point where you can at least enjoy the things that you want to do, and it's not in so much pain that it's not making it worth it. So trying to get her to that point that she's excited to go to these classes, blow off some steam, and not in pain during or afterwards too much. So, yeah.